Are you tired of the crippling pain of gout that seems to strike out of nowhere? Are you looking for reliable and effective treatments? Then stay tuned to find out how. In today's video, I will focus on the treatment of gout and how to manage this painful condition. I will be discussing everything from common medications like allopurinol, Febuxostat, and colchicine to newer treatments like pegloticase and methotrexate. I will also explore the crucial role of lifestyle changes and help you understand when treatment should be initiated based on the latest gout guidelines. So let's dive in right now.
Rheumatologistoncall.com.
Hi, I'm Dr. Girnita, the founder of Rheumatologist on Call. Now, to truly comprehend the treatment options, it is essential to understand what gout is and how it affects your body. Gout is a type of arthritis affecting about 9.2 million people in the United States. Gout is characterized by sudden, severe attacks of pain, swelling, redness, tenderness in the joints, often at the base of the big toe, but many other joints can be affected. It is caused by the buildup of uric acid crystals in the joints, leading to inflammation and intense pain. If you want to learn more about gout, you can watch this video in my channel where I discuss the most common 5 signs of gout. Although the treatment for gout has been available for many years and it is not expensive at all, many people are still not sure when they should start the treatment, what is the most appropriate treatment, how long should they be on the treatment, and what are the long-term consequences if they are not on the treatment. However, leaving gout untreated for many years can cause many complications, from joints being affected, even destroyed by multiple gout attacks, to deposits in the skin like tophi, to kidney stones, and even kidney disease. Today, we will address all of these aspects. Should you treat only the gout flare-up, or should you treat long-term to decrease the uric acid level? If you have only 1 to 2 flare-ups of gout every year, then your doctor may decide to treat only that flare and just monitor you. Now, this is the time when you should look over your diet and make some important changes. And if you want to learn what are the best and the worst foods that may trigger a gout attack, watch this video in my channel and learn how food can help you prevent a gout attack. If you have more than 2 flare-ups per year, then it is time to start long-term therapy that we call Uric-lowering therapy. This type of therapy is aimed to decrease the amount of uric acid which is produced in your body. And there are also a few other indications for starting this type of therapy, and these are if you have 1 or more tophi, if you have X-ray changes due to gout, if you have the first flare-up, and if you have chronic kidney disease more than stage 3, if you have kidney stones, or if you have a uric acid level more than 9 milligrams per deciliter. You should discuss with your doctor if therapy is beneficial for you or not. If your uric acid is high, more than 6.8 milligrams per deciliter, but you never experience gout flares or you never had tophi, there is no need for you to be on long-term therapy. Gout flare-up treatment. A gout attack can cause debilitating pain. To treat a gout flare-up, I use a few medications. Colchicine, this is a medication that can reduce inflammation and can alleviate pain. However, colchicine should be started in the first 24 hours of the gout attack to be effective. So if you don't have it handy, usually by the time that the patients will get to the doctor, they pass that 24-hour window and it is not effective anymore. If colchicine is ineffective, then I use NSAIDs like indomethacin, ibuprofen, naproxen, or Celebrex. But If you suffer from kidney disease, then you should definitely avoid NSAIDs, and you should start on prednisone. Prednisone is a steroid medication, and it is very powerful because it's going to decrease the attack in a couple of days, and it will decrease the swelling and pain maybe in hours. In some of my patients, I can give them an injection with steroids that can help the patient heal faster. Common medications for gout. Now let's move on to the medications that are commonly used in the long-term treatment of gout. Allopurinol and Febuxostat are medications that help lower the level of uric acid in your body, and they prevent the formation of crystals in your joints. Both of these medications decrease the production of uric acid in the body by inhibiting a specific enzyme called xanthine oxidase. Allopurinol is usually the first-line medication. It's preferred even in patients with chronic kidney disease. Many patients tolerate this medication well, although some can develop some side effects. If you are an Asian of an Asian background, you should pay attention as there is a higher risk to develop side effects. Febuxostat. This can be used to replace allopurinol, but it should be avoided if you have a history of heart attacks, because there are some reports of increased risk of cardiovascular events with this medication. So disclose to your doctor if you ever had any heart problems. The goal of this therapy is to decrease and maintain uric acid level to less than 6 milligrams per deciliter. Newer treatments for gout. When patients fail therapy with allopurinol and Febuxostat, when they continue to have multiple flare-ups and multiple tophi, at that point I recommend the newest treatment called pegloticase. It's a recombinant uricase created by genetically altered variant of Escherichia coli, which exerts its mechanism of action by catalyzing uric acid to the water-soluble purine metabolite called allantoin. Once the uric acid is oxidized, it is ready to be excreted through the kidneys for elimination, which makes this agent very good to treat patients with gout. So it is usually given to patients that fail allopurinol and Febuxostat. This is not a pill, this is an infusion, which is given to patients through an IV therapy every 2 weeks. This is a powerful medication, but you should also know that can cause allergic reactions, and many patients develop what we call antibodies against the drug that can decrease the efficacy of this medication. That is why a relatively new study published in 2022 showed that associating a low dose of methotrexate to pegloticase, about 15 milligrams of methotrexate per week, it might improve the success of this drug and can decrease the number of people that develop antibodies to the medication. However, this is a small study in only 14 people, and we need further studies to see if this effect is sustained in larger studies. Lifestyle changes. What I tell my patients in my practice, rheumatologist on call, is that medication is only one way to manage gout. Lifestyle changes play a crucial role in preventing gout attacks. This includes maintaining a healthy weight, exercising regularly, and avoiding foods that are high in purines, such as red meat and seafood, and alcohol, especially beer. Drinking plenty of water and eating a diet that is rich in fruits and vegetables can also help you manage your uric acid levels and can decrease the frequency of gout attack. Now, if you want to learn more about foods that you need to eat, check out this video in my channel. So there you have it. In this video, I covered the common and the newer medications for gout, the importance of lifestyle changes, and the current guidelines for when to start treatment. So remember, the key to managing gout, it's a combination of effective medication, lifestyle modification, and a regular consultation with your physician. It is very important to have access to a physician when you need it the most. And that is the role of my practice, Rheumatologist on Call, to be there for patients, breaking any geographical barriers and offering care in the most difficult moments. Thank you for watching. If you found this information helpful, please give this video the thumbs up and subscribe to my channel to support my educational efforts. And if you have any questions, please leave them in the comments below. Stay healthy, and I will see you in the next video. Bye-bye.
Rheumatologistoncall.com